Yeah. Very good evening, guys. I hope my audio and video is clear. So today we'll see some MCQs on PPH. We'll have a short discussion on the MCQs of PPH. Okay. Good evening, Daruni. Good evening, Hemant. So welcome to the YouTube Unacademy platform. Good evening, Chennam Shetty. So we'll start with the true and false. We'll start with one true and false. Good evening, Rahul. Right. So we'll start with the first question as a true and false. Okay. So it's either you can answer all the four statements answers or you can give one after one. Good evening, Narendra. Starting with the first A. The following statement are related to PPH. Okay, it's not except I'm asking you true and false. I'm asking you true and false. A. It is always a preventable condition. True or false? So as I see all of you answering, A is false. If it is always a preventable condition, then we never used to see PPH, right? What is the most common cause of maternal mortality in India? What is the most common cause of maternal mortality in India? I'm still at A. I'm still at A. My question is, what is the most common cause of maternal mortality in India? The best answer would have been hemorrhage. Instead of telling PPH, the ideal answer would have been hemorrhage, because hemorrhage may I definitely agree with you. PPH is the majority of it, but apart from PPH, ruptured ectopic or your abortions leading to a lot of blood loss, all these also account for your maternal mortality. So most common cause of maternal mortality in India is hemorrhage, right? In hemorrhage, most is because of PPH, right? Okay. What are we doing to prevent PPH now? What is that which we are practicing now to prevent PPH called as? Just tell me the name, what we are doing now to prevent PPH. What are we What is that management called as? Very good, excellent, Vimal Taruni. So that is nothing but active management of third stage of labor. So now what we are doing is called as active management of third stage of labor, which is used to decrease the incidences of PPH. So all of us are supposed to follow active management of third stage of labor, right? So what are the four components which you have in active management of third stage of labor? So the four components which we have in the management of active management of third stage of labor is: first, immediately after delivery, injection oxytocin. Injection oxytocin. I'm writing as injection oxytocin because it's not only oxytocin which we can give. We can either give oxytocin, or we can give methergin, or we can give misoprostol. We can do any of these, right? Second is, after the injection oxytocin, so once after the baby delivers, within 1 minute, you will see the sister immediately giving oxytocin. So you can either give oxytocin, alternative to oxytocin is methergin, alternative to methergin is misoprostol. After the injection oxytocin, the next thing which we do is delayed cord clamping. So we wait for the cord pulsation to stop and then we apply the clamp so that baby will receive extra 80 ml blood. Okay. So the second thing is delayed cord clamping. Right. Very good, Vimal. So what is the third thing? Dharmendra, what is the third thing? Yes, you have already written the third thing. After that, we do the control cord traction, or we also call it as, so somebody has written it's also called as Brands-Andrew method. It's Brands-Andrew method. Okay, so Raghu, so the fourth one is, so this is very, very important, AMTSL. Even in our dreams also, we should not attempt a mistake on AMTSL. And somehow I have observed AIMS is somehow allows, PPH is one topic which is favorite for AIMS or any exams, because PPH is very common in India. So they all want to know, they all want you to know some of the basic things which happen in India, right? So injection oxytocin, delayed cord clamping, control cord traction of Brands-Andrew method, and what is the fourth step which we do? I will tell you the contraindications of delayed cord clamping. I want you to answer what is the fourth step in the AMTSL. Good evening, Vipin. It's no more uterine massage. Uterine massage has been kicked out. Too much of massage, so massage is now gone. So now what we have is intermittent uterine tone assessment. Intermittent uterine tone assessment. Okay. So everyone who is listening this video, so please remember, in AMTSL there is no more uterine massage. This was asked in AIMS. Now uterine massage has been replaced by intermittent uterine assessment. You don't require to do massage. You just have to touch the uterus and see. If it is contracted, you will feel as hard as a cardboard. If it is soft, you will feel like a balloon filled with water. Somehow a sock, you can indent it, right? So these are the four things which you have to do in a active management of third stage of labor. So this is a recent update. So how do I remember this? The mnemonic for this is IDBI. IDBI. So we all know IDBI bank. So the mnemonic for this is IDBI. Injection oxytocin. I want you to know oxytocin में oxytocin भी दे सकते हैं, methergin भी दे सकते हैं, misoprostol भी दे सकते हैं. So injection oxytocin. D is delayed cord clamping. B is Brands-Andrew method, which is also called control cord traction. Last I is intermittent uterine tone assessment. So remember this way, IDBI. Okay. Right. So now next Daruni was asking me what are the indications of control cord traction. Now this is one of the biggest controversy which keeps on running. So I will tell you, according to ACOG, these are the indications of delayed cord clamping. So indications of delayed cord clamping are, indications of early cord clamping. Ideally, you should always do for everyone delayed cord clamping. What are the indications for early cord clamping is what I am going to tell. Before that, I am going to speak to Rahul's doubt. What do we do in intermittent uterine tone assessment? Before we used to do massage. मतलब whether it is contracted or not contracted, irrespective of that, we used to do the massage. That is, you hold the fundus and you go on pampering it like the massage, right? But now what we do is you just have to palpate. Every 10-15 minutes you can just palpate, and later we go half an hour palpation and see whether it's contracted or not. Okay. Hello, Pankaj. Okay, I think now it is going to come. Right. I'm sorry. Okay, I think now is it audible? Is it audible now? Is it audible now? Right. Okay. Okay. I was telling about the indications of early cord clamping, right? So according to ACOG, the indications for early cord clamping are so number one, mother hemodynamically unstable. It's fine now. Yeah, yeah. Fetal distress. And when cord circulation not intact. Cord circulation not intact. Only these are the indications according to ACOG. And cord circulation not intact, we have abruption, cord avulsion, IUGR fetus with IUGR fetus with abnormal Doppler finding. According to ACOG, only these are the indications for early cord clamping. Okay, only these. Now, some of the queries which or some of the answers which we can see there, that is RH negative, preterm. These according to ACOG or many studies, preterm may the better thing is doing delayed cord clamping. So preterm it is delayed cord clamping only. Okay, and RH negative also what the studies have shown is they also the risk, the benefit overweighs the risk. For RH negative, for preterm, the benefit overweighs the risk. Even for HIV, according to ACOG, according to WHO, according to British guidelines, and according to NACO, only NACO is little different, but British guidelines, ACOG, and WHO, all these tell that you're supposed to do delayed cord clamping for HIV. Whereas NACO told do early cord clamping after cord pulsation stop. Ideally, after cord pulsation stop means it is delayed cord clamping. So somehow I think NACO is also trying to tell towards delayed cord clamping, but there is one word wrong, that is early. So you stick to this. That is early cord clamping is for these conditions according to ACOG. Now if we understand these, mother is hemodynamically unstable, then I cannot tell no, I want 80 ml extra blood to the baby, right? So you have to immediately clamp the baby and take the mother for resuscitation. Fetal distress, more than baby receiving 80 ml blood, baby should receive early resuscitation. So you have to take. Cord circulation not intact. It is through umbilical cord you are getting extra 80 ml blood to the fetus. So if cord circulation is only not there, then there is no purpose of your delayed cord clamping. So these are the indications of early cord clamping according to American College of Obstetrics and Gynecology 2012. Right guys? Let's go back to the next question. Next B. Atonicity of the uterus is the commonest cause. True or false? Atonicity of the uterus is the commonest cause. True or false? So, right, atonicity is the most common cause of PPH. Okay, I have a question from Rahul that delayed cord clamping means how much time? So ideally you should wait till the cord pulsation stop, or you can vary from 60 seconds to 3 minutes. So minimum 1 minute you should wait before clamping the cord. Minimum 1 minute, maximum 3 minutes. Okay. Right. Atonicity is the most common cause of PPH. What are the causes of PPH which you know? So causes of PPH can be divided into 4 T's. That is tone, trauma, thrombin and tissue. Right? Tone, trauma, thrombin and tissue. Tone, trauma, trauma. Among all this, the most common cause is atonicity. The most common cause is atonicity. Right? Trauma, any cervical or vaginal laceration. Thrombin matlab your bleeding and coagulation disorders. Tissue is retained placentas. Intravenous ergometrin with delivery of the anterior shoulder is a prophylaxis. What about C? C. Intravenous ergometrin is a with delivery of the anterior shoulder is a prophylaxis. Is it a true or false for C? Yes, lumen, flash LOL. So I am seeing many mixed answers of true and false. False, 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 false. Okay. So what are you doing for the prophylaxis? Again, let me start back this way. Okay, those who have joined late. So those who have joined late, what is the prophylaxis of PPH which I taught you? Prophylaxis of PPH is active management of third stage of labor. How do you remember? I told you, remember it by mnemonic of IDBI. I, injection oxytocin. That is, you can either give oxytocin or you can give methergin, and the other name for methergin is methyl ergometrin, or you can give misoprostol. So here you are C. Again I have asked the same question. C. Intravenous ergometrin with delivery of anterior shoulder is a prophylaxis. As I told you, you can either give oxytocin or methergin, which is nothing but methyl ergometrin, or misoprostol. So this sentence goes for a true. This sentence goes for a true. Okay? Understood everyone? It's not just oxytocin. This was also asked as an MCQ in your aims. Okay? In a different manner. So I just want you to incorporate into the brain that it is not just oxytocin. मानो अगर oxytocin नहीं है वहाँ पे, then you can use methyl ergometrin or you can also use misoprostol. Clear everyone? Remember IDBI. Okay? Yes, I have a question from Priyanka. What are the contraindications for ergometrin? Okay, this is very, very important that you should know everything about every drug, right? So as it is a short class here, I'm not telling you about everything about the all drugs and everything of PPH. But yes, if you're interested to learn everything, you can definitely join the Unacademy platform, where we have the detailed course where we'll have the notes of it. But as Priyanka has asked, what is the contraindications for ergometrin? You can also type and help. So what are the contraindications of ergometrin? So basically ergometrin will cause vasoconstriction. So the contraindications, you can remember it as topic. Contraindication of ergometrin, you can remember it as topic. T, after delivery of first twin. P, preeclampsia, eclampsia. I, isoimmunization. So that is isoimmunization, is nothing but your Rh negative pregnancy. Rh negative. C, cardiac disease. C, cardiac disease. Okay, so these are the contraindications of ergometrine, right? Akash, the promo code is Dr. Ramya. One second. Yeah, this is the promo code. Dr. Ramya-yt. Okay, right. So you can remember it as topic. Right? Okay, let's go to the last question. In the true and false. That is, blood loss during cesarean section exceeds quantitative definition of PPH. True or false? Very good, Raghu. So this is a true. This is also a true, right? The definition of PPH is blood loss more than 500 ml. So when you tell quantitative definition of PPH, we basically tell it is blood loss more than 500 ml. So blood loss more than 500 ml during a cesarean section also we can have 500 ml of blood loss. So the blood loss during cesarean section exceeds quantitative definition of PPH is normal, is correct, right? So definition of PPH is blood loss more than 500 ml during cesarean section and blood loss during vaginal delivery and blood loss more than 1000 ml during cesarean section. But actually I feel more than this the better definition is ACOG definition. ACOG definition is drop in hematocrit by more than 10% and need for blood transfusion right? Okay, can you tell me what is primary PPH? What is primary PPH? What is secondary PPH? Yes, Jia, Lumen, Purnima, Narendra, what is primary PPH? Primary PPH is bleeding within 24 hours of delivery. Right? What is secondary PPH? Very good, excellent. So bleeding within 24 hours of delivery is primary PPH. What is secondary PPH? Bleeding. Secondary PPH? Bleeding after 24 hours and within. Okay, so I have Lumen answering 12 and Sohini answering 6 weeks. So according to RCOG, as Lumen has answered, according to RCOG, that is Royal College of Obstetrics and Gynecology, bleeding after 24 hours and within 12 weeks of delivery. Whereas some books also give it as within 6 weeks, but according to RCOG, it is within 12 weeks of delivery. Okay? Right? So which is the most common cause of primary PPH? Most common cause of primary PPH is atonicity. Whereas what is the most common cause of secondary PPH? So most common cause of secondary PPH is retained tissues. Okay. Now this PPH topic should be like, matlab, even if somebody wakes you in dreams also, you should answer PPH taka tak. That perfect you should become. PPH, there are certain topics which are always expected in an exam, like PPH, preeclampsia, diabetes, your cancer cervix. Matlab, this topics one question to definite in your aims especially. Okay, so you should be very much perfect with PPH topic and all these definitions, everything you should be 100% perfect, and all the drugs, dose, maximum dose, everything, right? So this was the first question which we were dealing. So PPH is not always preventable condition. Atonicity of the uterus is the commonest cause, is it true? And intravenous ergometrin can also be given as an alternative after the delivery of anterior shoulder. Blood loss during cesarean section exceeds the quantitative definition of PPH is also correct, right? So what you have learned now is AMTSL. Mnemonic for AMTSL is IDBI. Those who have missed the IDBI mnemonic, see the starting of the video, okay, later. Right. Let's go to the next question now. Following complications during pregnancy increases the risk of postpartum hemorrhage except hypertension, macrosomia, twin pregnancy, hydromenose. What's the answer for this question? Yes, Banu, Sunny, Usha, Narendra, Paul. A1, very good. Hypertension, okay. Can I get some other answers also? Can't see the video. So I have the options of many of you answering D. So you have a confusion between D and A. Okay. Right. So now let's understand this question. So they asked what are following complications during pregnancy increase the risk of PPH except, right? So we told that most common cause is atonicity. Right. Now what does this atonicity means? After delivery of the placenta, it is the crisscross fibers or the living ligatures. Crisscross matlab the pattern of the muscles is in such a way that spiral arteries will come in between and these muscles are arranged in a crisscross fashion and they will close and they compress the spiral arteries so that there won't be any more further bleeding from the placental bed. That is the middle layer. Okay, to be more precise, these are called as Pinard's living ligature. These are called Pinard's living ligature. Okay, so whenever your middle crisscross fibers are not able to close, then we call it as atonicity. Now, whenever you have big uterus or whenever you have big placenta or you have some structural problems in the uterus, then your uterus cannot close properly. Now, the simple funda of this question was anything anything which uterus was too huge. Macrosomia, how is the uterus? Huge. More surface area, more chance of atonicity. Twin pregnancy, again uterus is huge and placental surface area is also more. So, chance of atonicity. Hydromenose. Hydromenose matlab polyhydromenose. Again uterus is huge and chance of atonicity. So, what is the answer which I am left with? Hypertension. So, answer here is hypertension. Okay? Right. So, you have to think of all those conditions where uterus is over distended and placental surface area is more. Yes, that's the simple funda. That's the simple funda. Okay? Right. Before I'll tell you one more, two recent advances in this class, two recent advances in the PPH before I stop this video. So let me show you the next picture. What is this? So what is this? So you can do follow me on Unacademy app platform where you can access me for some more special classes or the free classes. Today night at 9 p.m. I'm having a special class on abnormal partogram. Ideally this month I have given a special class or the free class on NST, CTG and partogram. We have learned these three things through a free class on Unacademy platform. In the app you have to go and download and you can just search for me and follow me, there you will find it. Today night I'm giving a special class on abnormal partogram. So all those who want to attend the abnormal partogram, have a short look on the normal partogram teaching which I have done. Okay, then it will be easy for you. Okay, so I have only two answers, anti-shock cuff, electronic monitoring cuff. Okay, right. Any other answers? So as you see here, this is called NASG garment. Okay, we are learning something new today. This is called NASG garment. Yes, this is called non-pneumatic. Very good, Hemant, Narmada, Sohini. Yes, it is called non-pneumatic anti-shock garment. Non-pneumatic anti-shock garment. So as you were all telling, this is a method of, so we all know the basic funda. Whenever we have a small cut, from our childhood we know that we should immediately compress it. Now we have here a big cut inside the uterus. The basic funda is I have to compress it. What are the possibilities which I can compress? So this was one alternative which was designed to compress the uterus. So here this 1, 2, 3, 4. This 1, 2, 3. These 1, 2, 3 will go around the maternal legs. Fourth will go around the maternal pelvis. This is the fifth. And if you see there's a bulge here. This will be strapped around the maternal abdomen. 1, 2, 3 will be strapped around the mother's legs. Fourth one around the pelvis. Fifth one is strapped around the abdomen. Now what is the advantage of this? What is the advantage of this? So here we are strapping. So what is happening to the blood circulation? It's going to be temporarily stopped. And in PPH, the most important is I want time. I want time to arrange blood. I want time to shift her to higher center. I want time to take her to OT. Time is very, very, very important in PPH. And by this, I'm having two things. I'm temporarily stopping the bleeding, as well as I'm buying some time so that I can shift her to higher center or I can arrange blood. So this is called as non-pneumatic anti-shock garment. Okay, so actually this is very beautiful. I really like it. You know, all you can reuse. ऐसा नहीं कि if you have used for one patient we have to throw it. We can wash it and reuse. मतलब मानो अगर हमारे medical colleges में एक दो भी है तो it is helpful, no? Especially in the rural centers, because most PPH we see in the rural, right, and referrals. So if they rural areas have this garment, it will be so helpful for them, right? Okay, so that was about today's session. So I'll be coming every week for telling you some recent advances or some questions and some topics discussion. Okay, so do follow me on the Unacademy app also for getting the updates. And in March, I am starting a new. In March, I'm starting a new capsule course on gynecology. where I'll be discussing all high yielding topics on gynecology, where we learn the subject as well as we solve the MCQs on it. So daily I'll be having from 3rd March the course is starting, and daily we'll be having the course between 10:30 to 12:30 a.m. Okay, and that's my referral code for 10% discount. And today we are having a session where we are going to discuss some abnormal patograms as well as abnormal CTGs. So definitely do attend the class. Thank you guys. Keep studying. All the best.